If you're a veterinary leader, founder, innovator, or simply someone curious about where our profession is headed, I want to tell you about the upcoming Animal Health, Nutrition, and Technology Innovation Conference in Boston this October 26th through 28th. Auntie brings together more than 500 changemakers across veterinary medicine, animal health, technology, nutrition, investment, and innovation. You'll earn RACE approved CE while connecting with leaders from organizations like Mars Veterinary Health, Modern Animal, and many of the innovators helping shape the future of our profession. This will be my first year attending, and it reminds me of how I felt walking into my first Veterinary Innovation Summit and realizing these are my people. Registration closes July 12th, so don't wait. Learn more at anti-us.com and use code VETLIFE10 to save 10% on registration. More information in the description below.
Some of the things that I maybe thought were luck before, some of it is maybe luck by being curious too.
She grew up with a surgery light in her playroom, asked for a stethoscope at age 3, but her biggest asset in her veterinary career was curiosity, which led her somewhere she never planned to go. Dr. Lindsey Kock is a second-generation veterinarian who has spent her career proving that the degree is just the beginning. She started as a mixed animal practitioner in rural southwest Iowa, getting lost in the middle of a snowstorm, building trust with producers one difficult call at a time. And then, as she puts it, she got that FOMO feeling she couldn't quite put her finger on and started following her curiosity. That curiosity took her down a path of DNA testing, traveling to vet schools and research labs across the globe, learning to speak the language of geneticists and scientists who were unlocking discoveries for human and animal medicine, then to exam prep and continuing education, then founding her own consulting firm, Deep Dive DVM. What makes Lindsey's story so applicable is how she got there. Every pivot came from following what lit her up, trusting her gut, and refusing to let the identity crisis of being a non-traditional veterinarian stop her. In this conversation, we talk about what it really takes to move from clinical practice into industry, why the veterinary perspective is so valuable for companies, what's the next wave of animal health innovation look like, and how to think about career and lifestyle not as competing forces, but as two things that can be creatively designed to coexist. Let's get to the conversation with Dr. Lindsey Kock. When did you know that you were interested in veterinary medicine? Are you an early identifier, or did it take you a little while?
That is a great question. And I thought you might ask too, Megan. So I was like thinking about this and kind of giggled a little bit. But my dad is a veterinarian too, and has been for almost 45 years. And remarkably, he's still in the very first job that he took right after graduation, which is, I think, probably pretty rare. So, he loves what he does. And I think, growing up, I got to develop not only a love of animals, but, seeing the way that they were part of the community too. But, aside from that, I think I first asked for a stethoscope when I was about 3. So I think that has always been on my mind. And the first house that we moved in, I guess the second, we moved in when I was like 1, and it used to be the vet clinic. And so I actually had like a surgery light in my playroom. So, I feel like there was a setup to this, but I've always thought about vet med. I've definitely kind of explored other areas too, but always loved animals, always loved science, agriculture. So it's always kind of a natural fit for me.
So what type of medicine did your dad do? Or does?
Mixed animal. So it's in a fairly, small town practice, private practice. And really a little bit of everything. He has a few partners too that have been there for quite a few years. And so they all have their things that they really enjoy. But, I think he's always like the small animal piece and surgery, in the large animal side. There's mostly beef cattle, but used to be a few dairies. They're kind of dwindling in that area of the world.
Okay, so that makes sense that when I was noticing the types of associations and things that you were doing in vet school, they were quite diverse. But before I get there, when you went into vet school, did you have an idea of what you wanted to do afterwards? And did that change at all in your 4 years?
Yeah, that's a good question too. I think, Before I went to vet school, when I was in college, definitely vet med was always on my radar. But, there's some time too that I spent some time thinking about, other career paths. And it was always science, I think, for me. But I went to a liberal arts school. And so all the science was pretty, general. So I did think a little bit about what a career in like research might look like. And I think some things that maybe steered me away from that was when I started looking at that as a veterinarian, I was like, gosh, I just don't, it seems like things might move too slow for me, or I might like it takes drug development and, those sorts of things take a long time. And I am such like a results driven person and really hands on. And so, it's interesting looking back because I think that research component like always resonated with me. But as I was thinking about the direction that I wanted to take, I was like, I think it might be useful to just get out there and, get some clinical experience, work for someone other than my dad, um, and get some experience. And I really, I waffled a lot between companion animals. I like dogs and cats, but I had grown up being really involved in like 4-H and FFA. And I think there was something like about agriculture too, whether it was, it's an emotional relationship that producers have with animals and ag as well. But there's also a business piece and, there's a piece of telling the story of ag and like where our food comes from. And I think ultimately like that large animal piece really resonated with me. And so that was kind of where my focus was at the end of school. I did a large animal track and went into a kind of rural mixed animal practice in Southwest Iowa to start my career.
What a great perspective. So I admit that I have a lot of more small animal focused individuals on the podcast. And when you look at statistics, there's a larger number of people that end up going a small animal route. You mentioned an emotional component with people in ag, and I don't know if everybody really gets a good perspective there. Do you remember any stories or moments of an interaction with people in ag where you say that? Like, do you have any good stories that you remember?
Oh, so many. Yeah, I'm trying to think of the best example to give, right? Because we think of that relationship with pets as an extension of our family, right? And so I think a lot of people think about that relationship, as a family member. And, within the ag space, it's really more of a, producers feel a responsibility for the animals that they care for, right? And so when things aren't going well, one, there's just an emotional weight of like the responsibility of being the person that's in charge of taking care of those animals. And then the second part is it's also their livelihood. So like the health of those animals is directly correlated to a producer's ability to put food on their own table for their own kids. And so it's almost like a double business aspect, relationship, responsibility aspect. But I think, one of the first times I think I became like really aware of that is actually during a preceptorship during vet school. I was in South Central Nebraska and it was calving season and actually didn't spend time with the vet there. I spent time with the herdsman that was helping the heifers calve essentially in the sandhills in Nebraska. And, I think just the long days, some days were pretty mundane. We were horseback and riding around checking cows. And I thought, you know what, like I am on the right track because I am glad to like show up when things go wrong and be able to help. But the patience and like dedication that it takes to do that and show up, all day, every day, and still have that same attention to detail, I was like, oof, like I can appreciate it, but like that wouldn't be for me. I don't think I'd be able to be a cowgirl per se.
Back to the you like things moving a little bit faster.
Yeah. Very game.
Again, I noticed like you were part of AABP and the Embryo Transfer Association, and I don't even know what the Academy of Veterinary Consultants is in vet school.
Yeah, so that's a group that are focused on like feedlot consulting and that sort of thing. So back to kind of thinking about different opportunities in school, I think, growing up kind of near the profession, I was probably more aware coming into it that clinical medicine wasn't the only thing that is available to us as veterinarians. And so I wasn't sure what my career path would look like, but I think I always had a curiosity for how it might look different than, a general practice. So, I think organized veterinary medicine is a great thing. And, I will say with my dad's influence, he always was really involved in our state association and in some of those you listed. But I think I saw the importance really early of being involved in those associations, to network, to learn more about the challenges facing each of those industries, and kind of get closer to exploring some of those career paths. So some great experiences being involved in those groups.
Yeah. I mean, that's great. That's exactly what, this podcast is about is keeping people curious and open-minded that there are so many different options. So glad that you were able to understand that early on and that, participating, getting experience helped you. Now, like all of us, we have to finish vet school and move on in the world. And so you joined a mixed animal medicine and surgery practice. We all remember that the
Yeah.
moment of transitioning out of vet school, becoming doctor, but what was it like for you? What was your experience?
Yeah. Oh, that's a great question. It was a great practice. So, it was maybe a little bit unique in that it was a mixed animal practice, but we had multiple locations. And so there were 4 locations, and from one end to the other, it was about 60 miles.
Nope.
And so it was, the practice area was pretty spread out. And so I think it was unique in that sometimes I might spend my mornings at one practice and then my afternoons at another one, which was interesting. I feel like to kind of navigate as a new grad, sometimes those days felt really fast paced. But the other good part is, there was often times, I had mentors or other veterinarians that were kind of crossing through. So even if I was by myself for part of the day, the chances that somebody was nearby and, could swing by to help with the surgery or, hop in if something was difficult or that I could call somebody on the phone. I think in that way, I had really like great mentorship in that first job. I think some other, like, unique parts of that role is that we had a couple pretty big sale barns in that area, so from a large animal perspective, I think that was an interesting learning curve as well in building relationships, with people, and we were located I actually lived in the center of the practice area, so a lot of times when people would, haul in animals for more complex like surgeries or that sort of thing. A lot of times I was the one close by to do that. So I think that was a big part of really building those relationships as a new grad that really, helped me to feel more comfortable clinically and kind of get started on my career path.
Is there one in particular? You don't have to name them specifically, but was there, a particular relationship that you really enjoyed, or one of those learning opportunities that still kind of stick with you?
Oh, this is a perfect, I mean, there are books that have been written, right, of like people's experiences, but I had one, I think this is so funny. It was a producer that happened to be pretty good friends with my boss. And so, to say that they probably had a little bit of favoritism, to a certain veterinarian, is fair, right? And I still remember there was one night, it was in the middle of a snowstorm, and it was probably my first winter, I think, there, and I was on call, and this producer calls, and he's standing outside in the wind, and I hear him say, "I have a cow," and it's, like, blowing wind. She had a calf, and I was like, "Okay." And it was cutting out, and I was like, "Okay." I was like, "So you have a cow, she had a calf?" And he's like, "Yeah." And I was like, "Okay." And I said, "Well, what can I do? What do you want me to do?" And he said, "Well, I want you to come out here and put the expletive back in." And I was, like, sitting there, and I was like, "What is happening?" And then he hangs up and before he hangs up, he's like, "Never mind, I'm calling my boss," right? And so I was like, "Oh my gosh, I feel so bad, like, he's gonna, call my boss, bother him, late at night, middle of a snowstorm." And so anyways, still not figuring out what's going on. I try to call him back, he doesn't answer. So I get in the truck and I head out. And anyways, it turns out he was trying to say that the cow had threw her calf bed. I had never in my life heard a uterus called a calf bed, but she had a uterine prolapse. So, anyways, long story short, I learned what a calf bed was, and I showed up just as my boss was, like, wrapping up, because I couldn't see through the snow. I got lost. So anyways, it was just all in all, I felt like very defeated, very embarrassed. But it was the next calving season. The same producer calls again, and it was a lot nicer day outside, a lot nicer spring day. And we go out, we put in the uterine prolapse, no issues at all. And I think like from that point forward, we just had like the best relationship, a lot of trust. He'd ask for me, request me to come out, So I think it's those types of like difficult situations. That one might have been a little more humorous than some. But I think once you go through something, tough with somebody and really, prove that you can be a trusted part of their operation, it really helped a lot. It was a game changer.
Yeah, that's a really good story. Well, so I mean, you're with this practice for a few years, and then, when you look at your CV, there's a pretty big pivot there. So what's kind of going on in these first few years out of practice? Do you start to understand what you do and what you don't like, and you decide to move a little different direction?
Yeah, that's a great question. I feel like I've been able to do that later in my career, but I think at that point it was still, I had that inkling to do something different when I got out of school, and I was at a great practice. We were starting to really put down roots in that community, but it just still like I just felt like there was something missing, right? And it was like this underlying sense of like FOMO just all the time that I couldn't put my finger on, right? And so I looked, I'm like, do I need to go back to school? Do I kind of need to lean in to specializing in something? And I mentioned, or you mentioned the Embryo Transfer Association. I was always, thought that advanced reproduction would be something of interest. The more I looked into that, like that's a little bit of a different lifestyle as well, So I think I was starting to think about that too, of like not only, what do I want to do, but what do I want my work-life balance to look like? And on top of that too, my husband is a farmer, and he is part of the family farm. So, virtual work wasn't as prevalent at that time. And so I had kind of a radius that I needed to work within as well. I think I got lucky, right? Like I was curious. I was like, I wonder what a veterinary geneticist does. Like I really liked genetics. It's interesting. And so I Googled it, and there was a role that came up on Indeed in kind of market development for a DNA testing company. And I thought, well, that sounds interesting. And so I think it was just the, perfect opportunity that I fell into, and an opportunity where it was a startup who had recently been purchased by a larger company. So, they were all right hiring someone, was without experience, because I think that they wanted to be able to train somebody, and technology was changing really fast at that time. It was a brand new role. So it really just, was a perfect kind of fall into an industry position.
And with this, I mean, you were there for a little while. You also did a lot of market development. So I can
Yeah.
only imagine, you've been a veterinarian for a few years, and you probably feel like I have so many other skills to to learn, or things to know. So what was that like, getting something very different? Probably at first, obviously exciting, or you probably wouldn't have taken it. But what was that process of like, because a lot of people forget how transferable our skills and our ability to learn and apply what we learn as we keep going forward. So kind of what were you learning along the way?
Yeah, that's a great question. And I think back to that time too. And, I didn't have a lot of formalized training. And I think I was so new to practice, right? So I was in practice for just shy of 4 years. And so I think I was still in that mindset of, I'm just going to have to figure it out and be pretty scrappy and take the information that I have, look things up when I need to. And so I think that, my brain was probably already in that place where this is just something else new and uncomfortable that I'm going to have to figure out. And I think about that sometimes, that if I jumped into a position today, would I have that same mindset of being so, willing and hungry to learn? And I tried to stay there, but I think as we progress in our career, we kind of expect more that, hey, this is the skill set and the things that I have and what I know. And the other stuff is stuff that I don't know. And I think what we forget is we can learn that stuff. We're really trained to know a lot over a, wide breadth of kind of different topics, and be able to really critically like discern what's important and make decisions. And so I think all of those things really helped me in kind of building that industry career. I think the other thing that was, great about the boss that I had and the company that I worked for at that time is they were looking to go into a new space too. So I didn't know what market development was. I think it's kind of a loose term for, when a market doesn't exist yet, you're essentially there to go build it, right? So there's components of sales, there's components of partnerships, of product development. And so one thing that my boss had encouraged me to do, we were trying to build DNA tests for dogs and cats. And he said, just go to the different places around the world that are doing interesting research and just talk to them. So I traveled to different vet schools in the US, internationally as well. I got to travel a lot. And I would just essentially show up and be like, hey, I know you've done some research work with us. I just want to learn about what you're doing and the research that you have. And I think it sometimes took people off guard, but over the years was finally able to start speaking the language. I don't claim to be a geneticist. I've learned a lot by osmosis by hanging out with smart people. But over time, it was interesting because those conversations where I started to hear hey, we found this interesting gene in dogs and we want to look at, you know, dogs are easier to kind of uncover interesting findings. Then we're going to take our findings to human medicine. Or, we hope our finding is going to help breeders, breed out this condition completely. And after a couple of years, we started to have more interesting conversations of well, if a vet was in practice, could they use the results in this way? And, oh, I hadn't thought of that before. So I think there started to be this interesting layer of feeling like I brought value because I was a veterinarian and, not apologizing that I didn't know what they were talking about. But it did take some time. So,
Yeah. One, I think you called these out too when you were in clinical practice, two things. One, you didn't specifically say, but a lot of what we're taught how to do as veterinarians is problem solve, which means you have to collect data and then you have just enough knowledge to be able to collect the data and connect the problem with the solutions. And the other one, which you did mention, was about relationship building and learning how to work with other people,
yeah.
which is not something we think about going into vet school, but is definitely something you have to learn once you're in practice. And both of those things, I can see how that could come into play when you're going around to other people that have expertise, and especially in agriculture, because you mentioned this too, a lot of the farmers or whatever their titles are, they really know what they're doing. And so working with experts in certain parts, but you still bring a very special perspective along with the problem solving skills and the relationship building skills that you're able to make connections. And I think that's not always something that we give ourselves credit for, is the ability to make connections to bring it back to how this can actually benefit the pet. Or honestly, maybe something people don't think about is how it could hurt the pet or the animal or whatnot. And so we have to make all those connections. So it sounds so interesting to be able to travel and work with all these different experts and experience different perspectives and cultures and just get all these different views of the, animal health. And I didn't ask you about it before, but I saw that you did a study abroad when you were an undergrad too. But do you have any thoughts about that? Like going to different cultures and just getting different views and how that might have impacted your own view of animal health?
Yeah. Oh, absolutely. And I think, it comes later in my career journey of learning about how people learn. But I think even, before that is kind of a foreshadowing is I think I've always been really interested in what people are passionate about. And I think, what if you identify what people are passionate about, you can identify, what you can learn from them. And so I think I learned that in practice probably because I thought I didn't grow up on a farm. I grew up a lot around vet med, but I didn't grow up, caring for animals for the most part, day in, day out, other than a bucket calf in the front yard, right? But that's different. But I didn't grow up, day in, day out, watching this herd of, how they behave and, when one might seem off and with certain terminologies, right? And so I think once you tap into that of things people are passionate about, and that can happen in research as well, you start to talk about researchers who are really passionate about human medicine and they're using dogs as a model for human disease. It starts to like open up this whole new world of like, oh my gosh, I think about it this way, but from a human perspective, they've got a totally different spin on it because, they have to look at this gene and this has to come first before they can do drug development. And, this is a challenge for them because it'd be so much more difficult to try to do this research in a population of people. So I think just starting to realize that people have different passions and then ask some of those questions and turn around and figure out how that applies to vet med has always been the case, and layering on that too, when you get into different cultures, I think there's some you like realize that really things are a lot the same, but then sometimes like there's subtle differences too. So, but I think that is neat how so many areas of science are so global. I think when I was in practice, I didn't realize how global our profession truly is, especially in the research area. But yeah, I mean, it's very common for, folks in academia to have collaborators all over the world. That's really cool, especially when you get into, specific things like cat genetics or, that sort of thing. It is just a small world.
And so I know you in 2020, start your own consulting firm and you're developing so many different views and perspectives and you're bringing it together. And then you're market development, you're spreading this into a brand new market. Like all these skills are coming together. When you started to decide to run your own consulting business, was that easy? Did you have some like, do I really want to do this moment? Like what was that process of taking everything you learned and then starting to run your own consulting business?
Yeah, I think, similarly to that move from practice to industry, I kind of fell into it a little bit. So, and I will highlight too, none of the moves that I have made have ever been easy. And I think back of like all of the tough decisions in my life, the toughest decisions I think have always been leaving something, which I want to highlight for other veterinarians too, because I think like we are not a group of quitters. Right. And we really care about people. And so I think in every position that I've had, there's always been people that I really care about and I haven't wanted to let anybody down. And so anytime that I've made that career move, it has been a really tough and emotional decision, but it's always been worth it. I don't think there's been any time that I made a move and I look back and I'm like, I wish I wouldn't have done that. So for anyone who's like grappling with that, I see you and it's so hard. But I think when I made the move from my first job in industry, I had a lot of really great experiences, but I'd kind of gone through the market development part and the product development part. And, it was a huge milestone because we had like built the thing, right? And we were in the process of like scaling a sales team and kind of the go to market things. And I started getting that weird feeling again of like, I don't know if I'm in the right spot anymore. And starting to just feel a little bit kind of more pulled from like that building phase that I love. So I took a step back from that role and was going to just kind of better understand, how I would fit in the industry and like what a good role might be to look for. And one of my past collaborators in that space reached out. They were in sequencing software and they were like, we're interested in getting into the animal health space. And we just wanted to see if you do some kind of light market research of what that industry looks like, what it would take to get there. And I thought, well, that sounds kind of cool. And so I took on that project for the summer. And at the end of it, I thought, I bet there's a lot of companies that are in that same boat where maybe they're not ready to hire a veterinarian full time, but they could definitely benefit from some insights to what use of that product actually looks like in clinical practice, understanding kind of the ins and outs and differences in the profession. So that was really how I fell into, making a run at my own business is I thought, well, maybe I'll give it a try and I'll see who else is out there that might have an interest in having a DVM on call for their company.
Yes. And one of the things I've spoken about is how it is wonderful to have the veterinarian voice and the perspective in the room with these businesses. And most of the time they want it. Sometimes they can't afford a full time. So it's so good that they do at least have the ability to contract or work with someone out externally. But when we talk about our colleagues who are brilliant and they're skeptical and they should be, can you speak to that? To like, were you ever skeptical? Now that you have worked with many different companies from startup to, larger organizations, just kind of that perspective of, it is important for our voice to be here and just maybe any of the emotions or thoughts that you've undergone working with different groups.
Yeah. Yeah, I think, I kind of think of my consulting business head as Deep Dive DVM, and I think of it as having like two phases of life so far. And so that first phase, lasted, I think I officially started in like April of, I think it was 2022. And it was kind of April through October, and which is not that long because I took a full-time job with one of my clients in October and then kind of scaled back consulting a little bit. But I think of how much I learned in that short amount of time. And it was interesting because, as I told you, my thought process with what I wanted the business to be, was really broad. It was just, an extension to someone's team and having a veterinarian on board. And in some cases, I found clients that were an absolute perfect fit. And it's worth saying too, like I basically found clients, I reached out to people that I already knew and just said like, hey, this is what I'm up to. If you think you have any opportunities, I would see interesting things that companies would do or share on LinkedIn. And I would just reach out and be like, hey, let's have a conversation. And then I went to just like a couple local networking events as well. And, it worked well, but I would say I found probably 25% of things that were great. Half of them were okay. And 25% I was like, oh my gosh, what am I doing? And I think what I found is the ones that were really uncomfortable, it was like there's this fine line between being an advisor and helping versus being a promoter. And so I think that was an important differentiation early on is like I don't want to be someone who's like blindly promoting something. I want to be someone who really just like helps illuminate science or make science make more sense to people. And the other thing I realized is there was two opportunities in particular that just felt like really hard, and neither one of those companies are around anymore. And so the other thing I learned is like just trust your gut too, right? Like if something just doesn't feel right, or you kind of cringe when there's a number that pops up on the phone, like those things, they mean something, right? And we all have a pretty good gut instinct. And so just follow your gut with the extra opportunities that you take on and, just stay really true to yourself on which things are a good use of your time. And that could be being on a board, being, kind of an extension or providing feedback to a company. I think it can also apply to some of the volunteer work that we do. Our time is so valuable. So, listen to your gut and pour that into something you feel really strongly about.
I know you mentioned that before this, you had stopped and thought about if someone was interested in getting into more of an industry role and what you might say. So, what were some of the things you thought about that you've kind of learned and you might suggest for anyone interested in getting into more of an industry role?
The first thing is really just like, leaning into the things that you're passionate about. So now that I'm in like the second phase of consulting, so kind of the quick story is I took on a full-time role that was in exam prep and continuing education and really had this like light bulb moment of like, oh my gosh, there's this whole other layer of like understanding how people learn that's like so important to all the rest of the stuff. But that aside, I think I came out of that experience really appreciating learning. And so, to tie that back to things that someone could do if they're interested in getting into industry is one, continue to keep learning, right? So keep leaning into those things that really, are of interest to you. And, maybe that's even just within your own practice. Maybe you really love dentistry or really passionate about itchy dogs. lean into that, like go to all the CEs, read all the papers, network with people in those spaces, talk to the companies that are doing development of therapies in that space. And I think, you're surprised when you're, I think, just happier because you're spending more of your time doing something that really lights you up. But two, I think you'd be surprised at the opportunities that you fall into too. Cause I think some of the things that I maybe thought were luck before, some of it is maybe luck by being curious too. So when you're curious and follow those things, I think luck follows you.
Well, on that note, you said lean into the specific things that are interesting to you. After you've been doing this for a while, what are the more interesting things for you? What are the things you tend to lean into and have more interest in?
Yeah, that's a great question. So one thing that is, notably missing in my kind of progression of industry is I have not really worked in any regulated spaces, things that require FDA, USDA approval. I've been on the side of DNA testing, I've helped companies that are working on software platforms, supplements, that sort of thing. And so I think, not that I really set out to do it in that way, but I think that I really enjoy the stuff that doesn't have as, like, clear of a you have to rely on the science more for the application, right? So, if you're thinking about, a new drug, for instance, you've got a ton of data that you've had to submit to the FDA that you can say, "Hey, it's clear that there's this exact outcome. This is exactly how I use it." And I think that I kind of do enjoy playing in those spaces that are less clear, right? So, I like the things where there's, like, this promise of how we could use something in practice, how it could make our patients healthier, how it could make our lives easier. But I like digging into that underlying deep science and kind of understanding those storylines that veterinarians would really care about. And I think what drives me is like, I want to make it easier for them. I know how hard it can be being in practice and trying to learn about all the new things. And on top of everything else that you have to do, doing something new is really hard. And I also know from a company perspective how hard it is to make that connection with veterinarians and be like, hey, this could make your life easier. This could make your patients healthier. And so I think, where the intersection of my business is now with Deep Dive is really like matching and aligning those two things. So helping companies to really just communicate value more clearly to veterinarians and helping them really kind of bring things to market faster is what I enjoy. So then again, moving quick, right? I'm a project oriented person. So
Exactly.
yeah.
Well, and then I know you've done a lot around innovation. I remembered you had said that you had gone to the Ag Tech Innovation Summit not too long ago. So as you're around all of this new science and trying to help see how it could be applicable in clinical practice and in other areas of animal health, what are some fun things that you're seeing that our veterinary audience might be interested in hearing? And then also, when you're thinking about the innovation that you're in and surrounded by, how do you see that this could impact, maybe more longer term, how we see animal health, how we see our careers in animal health? Kind of what's your perspective there?
Yeah, I think the first thing I've really noticed, and maybe this is even like a caution to veterinarians, is there's this wave of things coming that I think is really wellness focused. And so, they might be activity monitors, they might be apps in agriculture, right? They're different monitors, they're different. Oh gosh, there's a lot of things. There was like one application where it actually is like this little device that sits in I think it's the reticulum of the cow and will monitor like, body temperature, all of this whole like long list of things, that you could use to monitor health. And it's interesting because I think that a lot of times when I talk to these companies, they're like, we don't necessarily, we don't need a veterinarian to prescribe what we have, but we want the veterinarian to be involved. And, I think they struggle with that because they say when we go to vets, they think about what they can prescribe or what we have to be involved in. And I think sometimes we kind of overlook, at how big of a trusted piece of that whole puzzle we are, whether that is with, a producer or whether that is with a pet owner. But as they look at those things for their animal's wellness, they're looking for our opinion on that too. And I think that companies are in a place that they often start out wanting to involve the veterinarian, but if it's difficult, then they make that jump and they go kind of direct to consumer, right? Direct to the producer, direct to the pet owner. And then we end up feeling kind of left out, that we're like, what is all this stuff? And, oh my gosh, they're trying to like overstep me and make a recommendation. And, and I feel the same way about that stuff too. But I think that we've, just need to kind of, it's hard, but I think pay attention to those things too. And maybe try to think more about how they integrate within how we practice medicine. So, there is always going to be a huge piece of our role that is treating and preventing disease. But I think as we start to think more holistically about health and what these innovations mean for health, being open to learning about that is really going to be to our advantage.
That's a really, really good perspective. And, bringing it back to career opportunities, right? Like just being willing to hear someone out if they're willing to give you a lunch learn, hey, enjoy the free lunch, just listen to and see what's interesting. And you never know when something might pique your interest. And going back to how you recommended, when you find an interest, like lean into it and, don't feel like you have to spread yourself out to everything if you're not interested in everything. But I think that's really when we can start a collaborative care. And I'm starting to bring that terminology into within other companies that are trying to support animal health. The more that, again, we can be part of that conversation, understand what's going on, we can link the right animal to the right solution because we're aware and we're in the know.
Yeah. And I think as a profession, that's what's going to really, get us further and make us more innovative is that feedback loop that we provide, right? So I think, sometimes we may get stuck of being like, oh, like I'm not an expert in this area. But I think experts are involved like early on in the development phase, right? So when a company is developing something new, they'll often reach out to experts, and want to talk to those key opinion leaders early on. But once something is kind of out there in the wild, the really valuable information is provided by the people out there in general practice that have just really practical advice on like, hey, this is why this is a pain for us to use in practice. It works against our workflow. We're seeing these side effects or we're getting this pushback from clients, depending on what it is. But being able to be part of that feedback loop is just going to push us further as a profession and help us to really go further and not be stuck.
Yeah, 100% agree. And, another thing that because I've been able to have several conversations with you, I know one of the things that you seem to like about your current workflow is that you do have say on how much you take on, and you're able to also pay attention to the humans in your life. You've got 2 kids as well. Any other thoughts that you've kind of learned in your career so far? Any learnings about yourself, about opportunities and what you're excited about in veterinary medicine?
Yeah, I mean, I just feel very lucky and very fortunate that at this stage in my life, I feel like I've found good balance. And I totally appreciate that is not possible for everyone. But I think, admitting that you can't be 100% into everything and everywhere at the exact same time, is a start to figuring it out. I have a 7-year-old and an almost 3-year-old. Just looking at, admitting that throughout your life, priorities will change, right? So, at this point in my life, it's a high priority to be able to kind of put work into a box and make it of a certain size so that I can spend more time with those guys while they're at home. But there's been other parts of my career where I've traveled multiple times per month. And, I think for me, like I look at my current life and I look back at those heavy times of travel and I look back to clinical practice and I'm like, oh my gosh, I don't know how I would have done that. But I think that's why there are different stages of life. And so one, don't be afraid to admit that, hey, like this is a stage of life. It might look different in this stage. Maybe I'm going to pull back. Maybe I'm going to give less of myself in this area, but it's not permanent. It doesn't have to be like that forever. So I think that's an important thing is thinking about that and kind of where you put your energy and focus at. But I think also just I've learned too, sometimes just sharing how you're feeling and, asking for what you want is huge too, right? A lot of times, even if you're in practice and something's not working, talking to your management of like, hey, is there a different arrangement? And just being creative, or being creative, maybe you cut back your clinical hours and you lean into some part-time work with a company. That's possible. So really just anything you can kind of dream up to help create the lifestyle that you want in addition to the career you want. I think those are two separate but related things. Taking the time to think about how those can coexist.
Humans are not mind readers. We need to let people know where we are. And most of the time, it never hurts to ask. And I love the call to think a little creatively. And hopefully, if you've listened to a few episodes on this podcast, you might get some ideas on how you can put what works for you together. And very good comment about the stages of life. Everybody is in their own stage, in their own situations. And sometimes that leads us to do things that we wouldn't have normally done, which allows us to figure out, oh, I either like this, or if I don't, that's still information, then you can change it. So
Yeah. And I mean, there's no playbook for vet med. Like your career can look a lot of different ways. And I think one thing that I've like struggled with on an ongoing basis is this like identity crisis that I'm always really concerned, like, oh my gosh, am I still using that degree that I spent all that money on, and the blood, sweat, and tears to get through school? And I think, I always try to remind myself that, hey, it's not what you learned, right? But it's how you learn to think. So I hate to admit, I still have like all my books and notes in the top shelf of my closet just in case, which is ridiculous because it's probably all out of date by now. But but I think too, I think there's a lot of us that we align so much of our identity with what we do day in and day out. And I think too, yeah, it's about your ability to learn and take in information and make decisions, less so than what is kind of the pictured idea of what a veterinarian does every day.
I think that's a perfect way to end, except that I always end in one particular question, and that is around gratitude. So when you think about something you're really grateful for, what comes to your mind?
Oh my gosh, I think the mentors, right? I think when I stepped away, especially when I stepped away from that first industry job that I had and I wasn't sure what was coming next, I think just gratitude for, all the mentors that I didn't realize that I had, people that cared. So I think it is like such a profession of people really caring for one another. Cause I think there was a lot of those relationships. I was like, oh, it's just business, whatever. But I think after each change that I've made, I've realized that those, relationships and friendships are really strong. So I am just like so grateful for all of the mentorship along the way from family and from people, who aren't family and didn't have to too.
I loved Lindsey's line, there is no playbook for a veterinary career. Thank goodness, but that's how people like Lindsey have figured out how to design one that works for them. If you want to connect with her or learn more about Deep Dive DVM, the link is in the show notes. And if this episode resonated with you, I want to mention that this conversation is part of a larger theme I'm exploring right now, what it looks like for veterinarians to go beyond the clinic and shape the future of animal health. If that excites you, I'd love for you to join me and Dr. Natalie Marks live at the AVMA convention in Anaheim on Sunday, July 12th at 2:30 p.m. Pacific time. We'll be recording a live episode of Vet Life Reimagined on that exact topic. Veterinarians beyond the clinic, shaping the future of pet health through startups and innovation. Details are in the show notes. Please come find us. For the key takeaways and reflection questions from today's conversation, head over to the Sprinkle of Wisdom Substack for the Podcast Club Guide. Please subscribe and share this episode with someone in your life who has the FOMO feeling and doesn't quite know what to do with it yet. And until next time, keep reimagining what's possible in veterinary life.